Hi, and welcome to the Healthy Built Environment for Health Professionals training series. Today we're excited to be introducing Annie Mauboules, who will be giving a presentation on the role of social planning. Annie is from the District of North Vancouver. Now I'll pass the mic off to you, Annie.
Thanks very much. I'm happy to be here today. My name is Annie Mauboules, and I'm a Senior Social Planner with the District of North Vancouver. Thanks very much for the opportunity to present to all of you today. I'm always excited to talk to people about social planning because I don't think it's as well known as some of the other planning jobs, such as transportation planning and development planning. So I'm really happy to speak a little bit more about the kind of work that we do in the municipality and in partnership with health. Next slide. Just to provide a bit of an overview of the presentation, I'm going to try to cover a broad kind of look at the work that I do today. And if there are any questions at the end, I've got my email for people to follow up if they like. I'll also talk generally about our official community plan and about what the social planning staff team's role is in the implementation of the OCP. And I'll also provide an overview of what our specific partnerships with health are as they relate to the OCP. So my starting point in these kinds of presentations is always the date our OCP was approved, because that was a big deal for us as a staff team. It was in June 2011, and it took a couple of years worth of work to get there. And really the official community plan, for those that don't know, is the guiding policy document for the municipality. And so we look to the OCP to guide all of the work that we do as a staff team. It's approved by council, and it really provides a broad framework to implement the planning work that happens in community. All communities have to have an OCP, and ours was actually very outdated. Normally they get updated every 5 years or so, and for us, I think in the District North Van, it had been something like 20 years since our last OCP, so it was definitely overdue and welcome for staff to have a fresh OCP to work with. So you can see from the map on the slide here the vision for our official community plan, and I'll get into a little bit more detail about it in a minute. But just to provide a bit of background, the 2015 population for the district was estimated to be approximately 86,000 people. The population did have some rapid growth in the 50s and 60s, but the rate has dropped significantly since then, and we kind of joke a bit about it, but between 2001 and 2006, the district's population only grew by about 50 people per year. So very, very stagnant growth. And clearly there were some issues that we needed to address as a result of that very slow growth. So the 2011 OCP provided clear direction from council on how to address the issues that were facing our community. It included providing opportunities for people to stay in the community and to have a clear plan on how to welcome a new diverse group of residents into our community to try to get the numbers up from about 50 per year to a little bit higher than that. The consultation for the OCP included over 75 meetings, which are many, many meetings with community in all different kinds of settings, in coffee shops, town halls, and neighborhood houses, and contact with over 5,000 people, so a lot of interaction with the community. And the vision was to manage growth and change. There was a plan to expect 10,000 new units and 20,000 new people by 2030. And the real challenge was, where were they going to go? So the focus of the OCP, as you can see from the map, was to focus that growth and change in our town and village centers, and we landed on something we called a network of centers concept. And you can see here the larger orange dots are the major town centers in Lynn Valley and in Maplewood, and then the smaller village centers just to the west in Lower Capilano Marine, and then over towards Seymour, Maplewood, Parkgate, and Deep Cove. So some of the key issues that the OCP highlighted, just to start on the positive, it really highlighted what was great according to all the consultation we did, and what people really loved were their neighborhoods, very community oriented, and lots of connection to neighborhoods across the municipality. The other part of what we heard back was people's love of the natural environment. So the North Shore and the district in particular has a really great connection with natural environment and lots of forests and trails and hiking, and people really did talk a lot about their love of that. But the OCP obviously also identified some key issues and things that really we needed to urgently address. One of them was the missing generation of people between the ages of around 25 and 40. And a lot of those folks would be folks with young families. And really, they were just missing. They weren't here. And the main reason for that is just there were no places that they could afford to live. So the district is about 80% single-family homes and only 20% multifamily. And those single-family homes obviously are very expensive. So families just couldn't afford to live here. The other issue was an aging population with dramatic increases in the vulnerability of seniors living in isolation. So many of these seniors living in those single-family homes at the top of really steep roads, in a way trapped in their homes because they could no longer drive and the walk was too far and there was nothing around for them to even go get some milk. And so really starting to see many, many more seniors being isolated. And also without an ability to downsize because there just wasn't any housing options for them. Some of the other issues were job loss. There were regional growth pressures. Obviously, increasing housing prices is a big issue for Metro. Environmental issues, as well as transportation issues. Most days we heard from many people about the gridlock for residents trying to move east and west across the district with just a real focus on people using their vehicles as the primary mode of transportation and difficulty accessing alternatives to using their cars, so not a great transit system. So those were some real key issues that we needed to address. So the planning framework that emerged as part of the OCP was really trying to get at how to solve those issues by 2030. So they're targeted really at providing some direction as we try to manage that growth and change coming to the community. So you can read on the slide what some of those planning directions are: a balanced, diverse population, growing smart, compact, protecting existing neighborhoods, and using land to lever transportation options, so to increase access to transit. Reducing the environmental footprint and trying to create employment here so people aren't having to travel off the North Shore to go to work. So the main focus, though, of the work in social planning is really to look at the needs of the people that are currently living here. So we don't focus on building the roads or building the infrastructure so much as we focus on what are we going to do with the people that arrive here, what kinds of services and supports and programs will they need to enjoy a healthy life here in the district. So Council's vision is to have a diverse population. And really, social planning starts to get really involved in that. You know, how do we do that? And some of the things that would be specific to social planning would be housing continuum, so having both non-market and market housing options, providing social and community services for people who need it across the continuum, as well as recreation services, and also making sure that there's vibrant open spaces for people to be able to meet and connect and feel part of community. So there's a variety of visions and targets in the OCP. I thought I'd illustrate these two specifically because they do speak to the work that we do in social planning, and they're really of critical importance to our staff team in implementing the vision of the OCP. So the first one is really recognizing that social services are important and need to be funded. And so having available funding that accommodates both aging infrastructure and the demands of growth. So a lot of the social, community, and recreation services are provided out of buildings. And so this target is really saying that we need to have some funding directed at making sure that those social infrastructure spaces actually exist. as well as the second one, a community hub facility within easy access of every town center. And so that really is speaking to the need to provide those social service and recreation programs in areas where we're going to have the most population growth, so that again people can walk to those services. We're providing those services to the greatest amount of people as possible by locating them in our town and village centers. So social planning staff really concern themselves with the services, supports, and infrastructure for our most vulnerable and marginalized residents. So at the District North Van, to talk specifically about our team, there's 3 social planning staff, and there's a focus on a specific sector and then a mix of issues as well between the staff team. It's actually a fairly rich staffing model, and it's not necessarily replicated in other jurisdictions. In rural communities, for example, you might have one planner that actually does everything, land use, policy planning, and includes social planning as really just a bit of a side of the desk activity. And so here to have 3 dedicated full-time staff is actually quite amazing. And we're busy. We're working full-time, and it seems like we don't get through the work. So it's great to have the support to have the staff team to deal with some of the things that we're dealing with. So generally speaking, there's some key areas of work that the OCP is directing us to focus on. And for children, it's access to quality, affordable childcare. It's access not just for group licensed nonprofit childcare, but also supporting family daycares in our more suburban neighborhoods. Also addressing child poverty and school closures, accessing space in schools for before and after school programs. So generally a focus on that 0 to 6 age group. And then also for what we're calling the middle years, which is the 6 to 12, with a focus on out of school care programs and how we can facilitate that. For young people, ages 13 to 18, increases in risky behavior amongst teens as well as the needs of youth transitioning into adulthood are a high priority. So it's the 13 to 18 plus the 19 to 24-year-old age group that is a focus of our work. And in that teen work, there's also a real focus on mental illness, which is really something that has emerged as a critical issue, increasing in something that's a real issue for young people and their families, and also a real lack of service or a fragmented service for that population. So that's something that we spend quite a bit of time on. So the other area is seniors, which I've talked a little bit about. The district has an aging population, and the needs of frail and isolated seniors is something that is, again, becoming a higher priority. As we realize that we're really lacking in, unlike our work with youth and children, we're lacking in specific policies and funding portfolios to be able to address this emerging need for supporting frail and isolated seniors. So that's something that's on our work plan and something that the OCP has really highlighted for us. So we're not really ready for the number of seniors that will need services and supports, and our geography adds to the concerns here because of how isolated this population is. So that's something I see is coming to be much more of a priority than we've seen in recent years. And finally, just to talk a little bit about some of the critical issues that we're seeing as a staff team, really cuts across all age groups. One of them is homelessness. It has been something, I've worked here for 15 years, and it's something that's, over the course of my time here, really become a major concern. In 2001, we were part of the first Metro Vancouver homelessness count, and we counted on the North Shore, not just the district, but on the North Shore, 45 homeless people. And by 2014, that number had grown to 127. And I know in speaking with our homeless outreach workers who work out in community, they guess at that number is probably half of the actual number of homeless people on the North Shore. Many of them are hard to find in camps, in the forest, and don't want to be counted, obviously. So homelessness is a huge issue for us. And we have managed to create an emergency housing continuum with a homeless shelter for adults and a safe house for young people who find themselves homeless. but now the critical piece of that continuum is supportive and transition housing for people who are ready to move out of shelters and start to gain some independence. So we just don't have that kind of inventory or supports in place yet, and is definitely something that we work on every day. Substance abuse and mental illness, both associated consistently with why people end up on the streets, also a major concern, not just for youth, as I mentioned before, but for adults. And so we're working with our other municipal partners and senior levels of government to create a service continuum to address the core needs of this group of district residents. So it's been really something that the OCP has helped to kind of daylight for us and focus our work to try to address. So I just wanted, just before I conclude, wanted to provide an overview of how all of that work connects with our colleagues in the health sector. So one of the things that I find interesting is in social planning we work with our health partners fairly regularly. We're often out in community working with our nonprofit partners, but also with health, with other levels of government, the faith community, volunteers. And so we have a really good working relationship with health. And so when it came time to update the OCP, I think it was easiest for our social planning staff to connect with health than anybody else, because in transportation and in development planning, parks planning, you don't really work a lot with health. And so we were a natural liaison with health, and definitely social planning took a lead in working with them to try to connect on the OCP. So we did that, connecting specifically about the OCP in 2009, and we met several times, and we were in agreement that a memorandum of understanding would be helpful to guide our work with regards to the OCP. And so we got busy drafting that document, which ultimately was signed in 2010. And signed by our CAO and Dr. Patricia Daly. So it never went to council as a formal council document, but has served us very well in formalizing the partnership that we envisioned with health. And the Heart and Stroke Foundation was actually also very involved early on by providing VCH with access to a planning consultant. And that consultant was able to spend her time working with us to draft policies and to create display boards and speaking points and attend meetings with the public in the development of the OCP. So some of those 75 meetings I mentioned earlier had staff involvement from VCH at a very direct level, which really helped to integrate the health lens into our conversations, our draft policies, and our presentations, which I actually think was really integral in making sure that health was kind of front and center in the development of our OCP. We did many innovative and great things together as well. We had walkability tours and world cafes, and we had op-eds in the paper by the medical health officer. And I think we were, as a result of that work, able to reach a much more diverse audience of residents than is typical in our regular planning processes. And I also believe that the way we framed our public consultation, which was from a health perspective, made for a much more compelling argument to encourage growth and change, which may not otherwise have been possible. I think we were able to really illustrate to people why it was important to accommodate the growth and change, and then more importantly, I would say, how to best do that to the satisfaction of everybody and to their overall health and well-being for a great community. So Vancouver Coastal Health officially was mentioned as a partner in developing the OCP, which was adopted, as I mentioned earlier, in 2011. And since that time, the MOU has been updated, and staff continue to meet about 2 times per year to discuss the implementation of the OCP and to find ways to collaborate on the important work that began in 2009. And so there was a lead up to an adoption of the OCP, but I would say even more importantly, since its implementation, how Vancouver Coastal Health and municipal staff have worked together to implement the policies there. And so it's really been a helpful thing in social planning to have that partnership, because many of the things that we do and the files that we work on, helping to support people in community, involve health and other levels of government. So it's been a successful partnership, and it's created many opportunities to create a really great community here in the District of North Vancouver. And so I'll conclude there. I hope it's provided a good overview of the work of social planning. It's you know, I could probably talk for a lot longer on all of the details of the work we do, but just not enough time here. I'd be happy to take email questions from anyone. My email's there on the screen. If anyone has any questions, they can send me an email or we can connect by phone and we can just discuss further. So thanks again for the opportunity to present on the work of social planning and partnership with health. And I look forward to hearing from anyone if they have questions. Thank you.